case. She developed symptoms on March the 11th and was tested at St. Mary's General Hospital on March the 13th. She was released to self-isolate at home on the same day. It has been determined that this individual is an employee of St. Mary's General Hospital and was symptomatic while at work on March the 13th. The individual does not provide direct patient care. In collaboration with St. Mary's General Hospital, Public Health is working to identify any individuals who may have been in close contact with this individual during the period she was symptomatic before self-isolation began. Again, I would like to say that we were anticipating and preparing for local circulation. That is why we had implemented measures to restrict gatherings and promote social distancing. While we will see more cases in the coming days and weeks, those measures will help slow the transmission of COVID-19 in our community. Therefore, I'm asking residents to continue to help us flatten the curve. Please follow the federal travel advisories, avoid large gatherings of 50 people or more, and even within gatherings of less than 50 people, and at any other time, please practice social distancing as much as possible. We can all play a role to help slow the spread of COVID-19 in our region, and we can make a difference. I would also like to provide an update on our latest case numbers in terms of number of cases tested. So total number tested, 603, confirmed positive, 12, confirmed negative, 356, and number of people in whom we're awaiting results, 235. And 247 individuals are being monitored actively by Public Health. So I'd like to end by saying thank you to members of our community who are following our recommendations, and please continue to follow them, and together we can help slow the spread. Thank you. I will now hand it over to Brian or Lee.
Thank you very much. I just want to echo the fact that this news sort of reiterates the importance of some of the steps that we're taking in the community around social isolation and distancing. I'd like to first of all comment on the staff member at St. Mary's Hospital and recognize that we of course hope that she is well at home and again will work through her recovery from the COVID. We have taken many actions actually this week at the hospital that I think will contribute to reducing the chances of this occurring. One is that we have really reduced visitors coming into the hospital. Today we've reduced that even further. We have established active screening at our doors for staff and for patients and visitors starting earlier this week. And in this situation as well, given that this team member did come to work on Friday, we are very quickly working to identify who she may have been in contact with at work and ensure that those employees are being followed up quickly to understand their contacts as well. So as appropriate, we will act with those staff. In the meantime, our major focus is on communicating with people to please do not come to work if you have potential symptoms. Please stay home. This is a time when we need to protect our coworkers and be sure that they can be healthy to deliver care. Thank you very much.
Thank you, Shuli and Lee. Now I'd like to invite Carmen from CBC to ask her questions.
Hi,
Hi, Shuli. So I just had a quick question. So you mentioned that there was an update. Obviously, you gave an update on the 11th case, but what can you tell us about the 12th case?
So that just came in very recently, and so we are still in the process of doing case and contact follow-up. So I don't have any more information really at this time, but I will have it for tomorrow's press briefing.
Okay. I'm also wondering, you mentioned there was about 235 pending, whether or not they are positive or not. I'm wondering, how does public health let those individuals know whether or not they are positive or negative?
So when we receive the results from Public Health Ontario Laboratory, which is the provincial laboratory, we communicate those results to those clients.
By phone, or what is the process?
Usually, yes. If we can contact them by phone, that's fast, and so we'll contact them as quickly as we can.
And how long does it take for testing to happen? The moment the individual goes and gets tested, and when you guys get the results?
So it can take about approximately 24 to 72 hours for test results to come in after they've been tested.
Right, okay. I was just wondering, so I just wanted to get an update. Yesterday you mentioned that there was one case that was hospitalized, but on the website, the Region Public Health website, it says that 2 people are still that were hospitalized. I'm just wondering, is it still just the one, or is it 2?
It's still just the one. So we had one of the 2 released from hospital, and the other one is continuing, is as far as I'm aware at this precise moment, still in hospital. But that person is also recovering, and if that person continues to recover, he is also expected to be released from hospital soon.
And sorry, could you specify what individual that is? The one that's still in hospital?
Yes. So I'm just going to get my notes. Hold on a second, just so I can make sure case number 3.
Sorry, case number?
Case number 3.
Number 3, okay.
Yeah.
I'm also wondering, and now that there is a case of, the first case of community spread, potential community spread, what is public health message to the community? I mean, what does this mean now for our community and the public?
Yes, thank you, Carmen. So, we had been anticipating that, and so in anticipation of that, we recommended the measures related to avoiding large gatherings and practicing social distance. So the advice remains the same. We want people to continue to do those things, and that will be the most important thing for them to do, as well as to continue to practice very good hand hygiene and respiratory etiquette.
Okay. I also wanted to ask in terms of Toyota. This morning we learned that there was a worker who tested positive, and we have a release from the company, from Toyota in Cambridge. I was just wondering, they mentioned that they had contacted public health authorities. Was Waterloo Region Public Health notified?
It was Hamilton Public Health who communicated with Toyota in Cambridge. So we were informed this morning that there was a resident in the Hamilton area who tested positive and who worked at Toyota. So Hamilton Public Health is providing advice to the workplace, and we will be working with Hamilton Public Health to manage any potential contacts at Toyota who live in our region.
All right. I was going to ask you that. So the individual lives in Hamilton, and that's why they're not added to the local numbers here, correct?
That's correct, Carmen.
Okay. I'm also wondering, in terms of, practicing social distancing and all these things and not being in groups with more than 50 people in a place like an assembly line or factory like Toyota, and there's other factories here in Waterloo Region, what is your message to the employers and to employees in that case?
Yes. So what I ask employers to do is to do as much as they can to enable their employees, regardless of the number that are in a space at the same time, to enable their employees to practice social distancing, and if possible, to enable their employees to work from home or to do their work via virtual means. So that's the general principle and recommendation that I'd like to give to all workplaces.
And I'm also wondering, at what point does the company legally is required to report a suspected case of COVID-19 to public health? Like, what are their responsibilities, and when should they report it to public health?
Yes. So normally, suspect cases are reported to us through our healthcare providers. They are. They have a requirement to report them to us. So if somebody is experiencing symptoms, we recommend that they seek health care advice through their primary care practitioner or Telehealth Ontario, for example. And then if they then receive testing, then the test results are reported to us in public health. So we get notified through our health care partners.
And what happens when they don't report it? What are the consequences or repercussions of that?
They are required to report it to us, and that's what they normally do. They normally do report it to us. And in addition, we also get the results of any lab confirmations directly from Public Health Ontario lab. So that's another way for us to be certain of cases that have been confirmed positive.
Okay, and I just had one more question, Shuli. In terms of telehealth and getting in contact with public health, I learned yesterday that telehealth. They were it was down, people were having issues connecting, and also, public health lines have been really busy and people haven't been able to get through. What should people do then? What should their plan be then?
So I would advise, people, if they're experiencing symptoms, to stay at home, even if it's minor symptoms. I know that, in general, most of us are not really used to staying at home if we're just a little bit sick, but in this situation, I'm asking all residents to, as soon as they start to have symptoms, isolate themselves from others and stay at home. If they're feeling well enough at home and they're still waiting to, speak with their physician, if they're still able to recover at home and they don't feel like they need immediate medical attention, then they can continue to stay at home and recover. If they feel like they need immediate medical attention, then they should go to their hospital or call 911. But that's in cases if they feel like they need immediate medical attention. Otherwise, if they can stay at home and recover there, that's what they should do.
Okay. And sorry, just while you were speaking there, Shuli, I was just thinking, you mentioned that Waterloo Region Public Health will be working with Hamilton Public Health with this Cambridge case. Could you walk me through, I guess, a little bit of what you guys will be working on, or how will you guys be working together on this?
Okay. So Hamilton Public Health has all the specifics related to the case and potential contacts at the workplace, because they're working directly with Toyota to get that information. And in the course of their investigation about contacts, they may come upon contacts who reside in our region, and at that point, they will provide us that information through an electronic and confidential means. And when we get that information, then we follow up with residents in our region and we provide advice. And of course, whenever cases span more than one jurisdiction, health units work together to ensure that our advice and recommendations is coordinated. But in terms of who is speaking with Toyota and providing advice for Toyota, that will be Hamilton Public Health.
Okay, and you mentioned earlier last time we spoke that public health won't be doesn't put up people's professions, but in this case, because it's a plant in Cambridge and there's a lot of people working there, is that something that public health would put on their website, like kind of saying, hey, if you worked here from these days, get checked out or anything like that?
Yeah, in general, I mean, you can't speak to what Hamilton Public Health will decide specifically, but in general, if there's a way for us to inform the people who need to be informed that they may be exposed, for example, by naming specific settings, we would do that without revealing any more identifying information about the case itself. So as long as we're able to identify the settings and the people in the settings who may have been impacted, we would not release any more information than necessary about the case themselves.
Okay. Those are all my questions. Thank you so much.
Okay.
Thanks, Carmen. Now we'd invite Matt from Global Chorus to ask his questions.
Hello. Just with with case number 11 here, can you describe the type of work that she was doing at St. Mary's? And do you have an idea of how many people might be isolated, and how will this affect operations there?
In terms of the type of work that she was doing, I can share that she's not involved in direct patient care. Beyond that, we won't be sharing further where she is to protect her privacy. In terms of the number of staff, that investigation is still very, very actively underway this morning, and so I'm not in a position to quote a specific number.
And are you expecting an impact on operations?
We'll need to just sort of see the outcome of it. Again, one of the things that we are doing at the hospital at the moment is we have moved to a reduction in some services, partially to ensure that we will have the capacity in the hospital to be able to respond as we need to. So at this time, I'm not envisioning that there will be an impact to services that way, but we still need to confirm.
And forgive me, I'm actually covering for a reporter in Kitchener who is off today, so I'm not really familiar with the specific things that are going on in Waterloo as I am with Guelph, but does Waterloo have like an external assessment clinic for patients? And if not, are there plans to open one?
I can take it from the hospital perspective. Okay. So currently, what we have done is we have opened clinics at both St. Mary's Hospital and at Grand River Hospital, so that we have an ability to see patients that get referred to us through public health and to be assessed and, if required, to be tested. So in that regard, those are the assessment centers that we have available currently. And part of that was also to be sure that we, if needed, could divert some of the flow through the emergency departments. We are very actively working with our public health colleagues to look at other assessment centers in the community as we need to develop them.
All right, thanks. Those are all my questions.
Thanks, Matt. Now I'd like to call on Joanna Wider from The Record.
Thank you. Related to the Toyota case, should that plant still be open and operating with thousands of people there and at least one positive case so far?
It depends on the level of risk that people, co-workers could have. So it's not a broad, just because we have a case in a workplace, the workplace needs to close. That will be which areas of the workplace, may need to close or not. That will be a decision made by Toyota as a follow-up to recommendations that would be provided by Hamilton Public Health. So yeah,
Okay.
yeah.
So you don't feel that it should shut down just to reduce the risk in general?
I don't have the specifics on the case and the workplace environment. Hamilton Public Health does. However, they are currently, as I understand, they are currently in communications with Toyota, and they will provide recommendations, and Toyota will follow up on those. But yes, there isn't a broad recommendation to close workplaces as soon as there's a case. It would depend on the degree of risk that other workers could be exposed to. And we also have to remember that it depends on the degree of ongoing risk. If there's no continuing exposure in a workplace, then there's no continuing risk to workers.
Right.
But that will be decided by Toyota in consultation with Hamilton Public Health.
Okay. And just regarding the case at St. Mary's General Hospital, trying to figure out how many people might have come into contact with this worker. When do you guys expect to have a number for that?
We're not sure at this point in time, but we are investigating expeditiously.
Yeah, absolutely.
Okay. And then related to St. Mary's High School, have there been any people who have become sick or had symptoms that could possibly be another case?
No, we've not received information about another case that we would consider suspect at this time. And Joanna, you had asked me yesterday about timing for the release of the information. So we were informed 2 days before we released the information that there could have been exposure, and therefore what we did right after we were informed was to investigate and confirm the exposure settings, and then work very quickly with the school and school board to confirm all those who could have potentially been exposed, and then we released the letter.
Okay. All right. Thank you for that extra information. And that's all my questions.
Thank you.
Thanks, Joanna. Aster Shetty from 570.
Hi. So I just wanted to check in with our risk level. Will it be upgraded now that there are 2 community transmission cases?
Yeah. So as I mentioned today, I'm announcing that we have one case that we have not been able to identify any link with travel or with contact with another case. So until proven otherwise, we take this as a sign that there is community transmission of COVID-19. I would say that yes, as we have more cases in the community, the risk will increase for people to contract COVID-19 in our community. That is why we are focusing now on ensuring that people know that if they develop symptoms like fever, cough, and difficulty breathing, they should stop going into work and self-isolate at home. And most people, 80% of people who get it, will be able to safely recover at home. And our other priority is to ensure that those who require more elevated levels of care, such as in hospital, are able to receive that. So the hospitals have already been putting measures in place in order to increase capacity in anticipation of future cases that may need hospitalized care. I would say that overall, there is not evidence of a lot of circulation at this point in time, but this is our first sign that there is circulation in the community, and therefore it just reinforces what we have been recommending to date, which is that people avoid gatherings that are, have a number of people and practice social distancing.
Thank you, Shuli. So just wanted to clarify then, we are still at a low risk level.
We are at a low risk level, but that risk will increase as we get more cases.
And do you think, how many cases would that be to bring us up to medium, just to speculate here?
That would be an arbitrary determination, what we would call low and medium. The important thing is it doesn't change what we do. It doesn't change what we recommend for residents. We recommend the same things as we've been recommending. We have put in place those measures to promote social distancing. Organizations and workplaces and businesses, they have been following our recommendations. There's been a significant decrease in places where people can gather across our community. That's already started. It's very good that that started before we started to have evidence of local circulation. So I really thank everyone in our community for following those recommendations, and that's what we need to continue to do.
All right, and now with this confirmed community contact case, which is a nurse from St. Mary's.
I didn't say it was a nurse. We did not say it was a nurse. We said it was an employee of St. Mary's Hospital.
Okay, rather an employee at St. Mary's Hospital. Will there be any additional steps taken by public health?
Additional steps taken by public health. They will be, we are working with the hospital right now to very actively identify potential contacts of this case. So that's the work that we're focused on right now. And the hospital has put in measures to reduce the risk for other people in the hospital and other workers. And I can maybe, if Lee wants to say anything, no. Okay, yeah. So that's hope you heard me there. But that's the hospital has already enacted measures actually to reduce the risk in the hospital setting.
Perfect. Thanks so much, Julie. And I also wanted to ask, because we were getting a lot of concerned calls from the community regarding a lack of prevention techniques at construction sites. Now that we have this COVID-19 situation, would you suggest that the Tri-Cities, Waterloo Region, or any local construction company should put a pause on any ongoing projects?
My advice to all employers, all businesses, is to heed our recommendations and put in place measures that will allow their employees to practice the social distancing that we recommend. And the employers are responsible then for putting in place the policies and procedures that would allow for this greater social distancing. So my recommendation would be for them to put in place measures that can help their employees practice social distancing.
All right. And the last thing to confirm, Shuli, I believe you already mentioned this earlier, but the tape experienced some interruption.
Sure.
I just wanted to confirm, out of the third and fourth cases, which one is out of hospital?
Okay. Just 1 second. I'll just confirm that in a bit. Yes. So the fourth case has been released from hospital.
All right. Thank you. Those are all my questions.
Thank you.
Thanks, Ashka. And Dan, do you want to ask questions on behalf of CTV?
Yeah. In terms of investigating where these people may have traveled throughout the region, like where they've shopped or what restaurants they went to, how do you investigate that?
Yeah. In the beginning, when we start to have a few cases, or even before we have cases, we do very intensive case and contact follow-up. As we get more cases and there are more settings in the community where the cases could have been, then at that point, we don't necessarily focus as much about every single potential contact or setting. we will focus, when we have the information, we will focus on letting people know that there's been, a case or contact in a particular setting. But because now we have evidence that there is local circulation spreading, what we want to focus on is to make sure that people, A, are aware, and B, take measures to practice social distancing. And for all organizations and agencies to also enable their employees to practice social distancing. So that's really what we want to focus on. Social distancing and those measures that we've recommended for reducing gatherings of people are effective measures. So that's really going to be more of our focus going forward. Thank you.
This concludes the media briefing today. We have another one scheduled tomorrow at 11:45. And again, I thank Lee and I thank Shuli for participating. And I thank members of the media for their thoughtful questions and helping us get the word out to the community at this very challenging time. Thank you.
Oh, sorry, Brian, one quick question. Sorry. Carmen with CBC. I just wanted to get, is it Lee or the spelling of her name?
Lee. And do you need my last name as well?
Yes, please, and your title, if that's okay, too.
Yeah, so it's Lee, Lee, last name is Fairclough, Fairclough, and I'm the...
Yeah, and so something like that, like in the health and wellness space, like to be able to do that and capture the attention. Like I feel like a lot of people, depending on where you're at, and like that's such a big journey for people to know. Like there's a certain period of time where it's like I can eat whatever I want, whenever I want, and stay out all night, and then you kind of hit that point where it's something that's just not possible anymore. And like there's different phases of how much people, I think, care about those aspects of their health and wellness.
Yeah, when you're young, you think you're invincible, right? You don't really put a lot of time and management into what you're doing. And if you tell kids, well, like, don't eat that food because, like, it'll affect your health, they're like, okay, yeah, maybe, I don't care, I'm going to eat this bag of Cheetos anyways.
Yeah. Then you wake up when you're 40 and you can't move your neck because you slept funny.
But then if you tell kids...
just a nightmare once you hit that age. Just kidding. 40's not so bad.
You look great, Tiff. You're 40.
Somebody give me a
You're
massage.
Not 40. Yeah. But if you teach kids, like, if you eat well now, you'll be able to remember your mom's name when you're 45, 50, 60. You'll be able to recall and have memories. Like, it impacts you in a more meaningful way, right? If you think about the mind and being able to wake up happy with gratitude and being able to remember, like Alzheimer's, there's such a huge link between Alzheimer's and the gut. So I believe there's so much research and so many voices in the health and wellness field. A lot of them really shame people for not being healthy enough, and it can be overwhelming and really confusing. And so I love to, through social media and through one-on-one, disseminate those small sound bites of foundations of health, which are actually really, really simple. Help people heal their relationship with food and let go of body shaming, food shaming, and just really build that awareness about what's going to help me thrive, what's going to protect my energy and help me show up in life the way I want to.
Yeah, healthy is just not a look anymore, right? I think it's important to try and drop that judgment too. And there's this book I read on diabetes once when I was switching over to an insulin pump, and it was about, I think it's a really hard disease that you're always trying to be perfect, and this whole thing is about, like, you will never be perfect, but you can always be better. And I think that's just such a good way to state things to a lot of people, no matter what you're doing, like, what is perfection? Like, or you should never think that you're perfect, you should always strive to be better. So